Welcome to the Mobility Shop Live. I'm your host, Justin. I'm here with Kyle Whaley. Kyle, thanks for joining us.
Pleasure, thank you.
Kyle Whaley is with Propel Physiotherapy. Kyle, tell us a little bit about yourself and Propel Physiotherapy.
Great. My name's Kyle Whaley. I'm a physiotherapist here in Toronto. I've been practicing for about 15 years with a special interest in neurological injuries, including older adults. I'm the clinic owner and director at Propel Physiotherapy. It's a clinic in the west end of the city.
Cool, awesome. So we'll get right into it. It's winter.
Yeah.
The weather outside is frightful, right?
It's freezing.
It is freezing. It's been a rough couple of weeks over the holiday season, New Year. I know minus 50 is difficult. The snow obviously the past couple of days. What are some tips, I guess, that you can give people with mobility issues, seniors, to avoid sort of that falls prevention or things that they can maybe do to avoid a visit to your clinic. Unfortunate. They should visit, but just not after an unfortunate situation. Maybe preemptive.
So we'll talk about the preventative end.
Yeah.
You want to maintain a healthy, active lifestyle. That includes some strength training, some flexibility, and some cardiovascular or aerobic training. And from the time you step out your door, you want to make sure you have proper footwear on.
Right.
So those are boots with some sort of tread that gives you some grip on snow and or ice. It's really hard for everybody to clear their sidewalks, but please, the community, and if around your own home, especially your step and your walkway where most falls occur, make sure the snow and the ice is clear. So that includes shoveling and salting. And if you need a hand, reach out, and neighbors should be doing their part to shovel and...
Right. So yeah, I mean, obviously weather is definitely an issue around this time of year. You touched on a little bit around sort of the preventative. So, we were talking earlier, actually, and you mentioned her off camera, around the Twitter. Was it a new boot that you had seen?
Yeah, it was really neat. I'll send you the link and you can put it up. I was on Twitter last night, and there was a really interesting article or a short video on a gentleman who's doing research on boots and the tread to make them essentially really sticky just grippy on ice and prevent falls. Falls are a huge cost to our healthcare. Yeah. And contribution to morbidity and mortality in the older adult population.
Right. I'll throw this back out to you as well. The fall, the hip.
Yep.
Is it the fall that breaks the hip, or is it the hip that breaks that creates the fall or causes the fall?
It's usually
in your opinion.
Yeah, it's usually the fall. I have heard that before. It's usually the fall.
It's maybe a misconception. I don't know.
Yeah, it's usually the fall that breaks the hip. So the impact of your the outside of your hip hitting the ground. Yeah, as you get older, your balance reactions and your strength aren't what they were before. Your balance in general, and unfortunately, combined with thinning of the bones or osteoporosis, you can end up with a hip fracture.
Right, and you touched on obviously cardio and sort of physical training or weight training, if you will. What are some recommendations around, training regimen? I think we talked about, starting off with an assessment by a physiotherapist, but, tell us what would be, the ideal plan of attack for anybody, I guess, of any age, to prevent, obviously muscle deterioration, aside from just getting up off the couch. But what are some tips that you would give to someone, say, on a daily basis, maybe some ideas of how they can stay active, or what are your thoughts on that?
So a regular exercise program, really, and we spoke about that briefly, but that includes a component of kind of strength training. So the evidence suggests that stronger muscles lead to better balance, especially in the older adult population. Right. Maintaining your mobility and your aerobic health through aerobic or cardiovascular activity. Walking is a great activity. You should try and do a little bit every single day. Right. Is really important. If you don't use it, you lose it. Some flexibility training. We talked about areas you could the community centers in the city have excellent programs, whether it's the Y or your local community center, for anybody, including the older adult population. They've got stuff targeted at mobility and osteoporosis classes and aquafit, stuff on land, low impact in the pool, cardiovascular. They've got some excellent stuff.
So a wide range of activities,
range.
And probably at all hours and times of the day and days of the week. So definitely you can accommodate pretty much anyone.
Oh yeah.
One of the things actually, you touched on there, and I know, having grown up playing sports, at various levels, not as skilled maybe as others, but I tried, stretching, right? And sort of that, as being, and I think, when I was sort of coming up, it was starting to become known that it was very important. I took phys ed in university, and I know we did a number of things around, kin and a couple of different things around muscle anatomy and different structures. Mm-hmm. Stretching. Tell us, how important is it, and what are some thoughts on ways? I think people, when they hear stretching, especially seniors, they think, it's awkward. They can hardly, bend over and touch their hips or knees. What are some ideas around ways that somebody can stretch that isn't, sort of doing a 45-minute stretch routine where they're, touching their head to their toes, but something that's more, kind of at their pace? Like, what are some ideas or thoughts that maybe you guys do in your clinic to stretch some out at the beginning of a session, or what are some thoughts that you would recommend? So
really, stretching's about maintaining the mobility in your joints and the length of your muscles. We usually recommend an active stretch, which is kind of, it's different than the passive stretch we think of just leaning into a stretch. Ankle rolls, moving your ankles, moving your wrists, gently leaning into a wall, gentle wall push-ups. That's what we would call an active warm-up,
right?
And includes a component of stretching, to help prepare the body for an exercise.
So it's that. I guess maybe that's counter, or not counter. It's sort of moving to the next level from maybe that thought of, sitting there, static stretch, reach, touch your toes, kind of stretch out. It's more of that, getting that sort of gradual movement and doing different sort of shifts in your body to stretch the muscles around those joints and whatnot. So, talked about cardio, wearable technology.
Yeah, of course.
Yeah, we'll go to that one, right? We did a lot of this off camera, by the way. No, so it's we've been talking a little bit about wearable technology. Obviously there's I think they've evolved tremendously. I worked for a company a few years ago where we were integrating wearables and devices on apps on your phone that would count steps and cycling and even as far as vehicles and stuff like that. But what are your thoughts on that as like a motivator, or what are your thoughts on wearable technology, and do you recommend it to your patients?
Mm-hmm. You know what? I think wearable technology is a great idea. We prescribe it often. The interfaces and the usability have really improved, I think, over the last 4 or 5 years. Stuff like a Fitbit.
Right.
There's lots of brands out there. Find what works for you. But yeah, it's a great way to track and monitor a lot of the things you're looking for, whether it's your heart rate, your steps, how often how much you're sleeping, how much you're moving around in bed at night. And it's a great motivator.
That's actually an interesting one. I have some friends that have one that were talking about their sleeping and how it tracks their sleeping, which is interesting.
Very interesting.
I'd be interested to see what my results would be like, but
it's a great way to monitor your progress, and therefore set goals from it. I think they're excellent.
Right. Okay. To sort of the physio side, obviously physio can be reactive, obviously a fall or an injury. We talked a little bit about being sort of proactive or preventative. Walk us through, how, whether it's reactive or proactive, how somebody comes in contact with you at your clinic, and what can they expect, from a visit to Propel Physiotherapy.
It's a good question. So sometimes we get referrals directly from family doctors or physicians.
Okay.
Usually a more reactive. So somebody's got a problem and an issue, and we would get a referral that way. You'd call our clinic, walk in, and get an assessment. But we're primary access providers here in Canada, which is great. So you can walk in and book an appointment with a physiotherapist if you don't have a problem, and maybe you're concerned about your mobility is deteriorating or your balance isn't what it was before. And you come into the clinic, we give you a full assessment and set up a plan of care for you after that.
Okay. So like, what would a plan of care look like? Obviously it's custom to each person.
Exactly.
Are you looking at sort of like a set maybe regiment of, once a week, once a month, once every couple days? How do you, like, let's say, I'll use an example, say, some of our people that are watching out there, let's say their mother has a fall, an injury, maybe doesn't break a hip, but you're looking at, some deterioration in the muscles and atrophy over a period of time. They're coming to you now, they've been released from the hospital. What should or could they maybe expect to get through Propel Physiotherapy? Is that too vague?
No, it's a good question.
Yeah.
Again, it's the caveat would be it's based on everybody's individual
Right.
program, but in general, what you're going to do is after your assessment, depending on your goals and what the physiotherapist thinks it's going to take to get you to that end goal where you want to be. Usually what we do is we end up seeing people, again, depending on the nature of why you've come to see us, a couple of times a week.
Okay.
Sometimes we see people for a shorter duration, kind of 3, 4, 6 weeks. And sometimes we have clients for a longer duration with more chronic conditions that require more care. We have clients that come in and just check in once a month for, a bit of a physical
like a follow-up
we
sort
call
of
it.
thing? Okay.
Yeah. And then we have clients that do a good job of injuring themselves often and keep coming back.
Re-injury?
Yeah.
More sports related, or are you deal more neurological, you said, and seniors? So
yeah.
you don't
so
necessarily
we
deal
do
with...
see sports. Yeah,
Okay.
we still, part of our caseload is still sports. Our focus or special interest is in neurological and brain and spinal cord injury and older adults. But yeah, it really depends on, it could be anything really.
I'm going to throw a curveball, actually. Just as you mentioned there, the neurological sort of spinal cord injuries. I know I see a lot in the news and a lot of different things are out there. How close are we to healing someone that's a para or quadriplegic? Is that? I mean, I'm just going to throw this out. This is more my own interest.
Yeah.
What? Not that I want to plan on becoming one, but what like. I've from what I've heard over the past even like year or two, there's some tremendous breakthroughs in reconnecting. You speak to it probably a little more technically than I could, but what are your thoughts on that? And is that something that's happening? I guess.
So I think the latest stuff I've read is they're making great strides. It's different. The rules and regulations are different in Canada, or different in the US, a lot different in Europe on how you can go about researching that information and testing that. But essentially, stem cell is really promising.
Right.
They can bridge the gap between parts of a severed spinal cord.
Right.
But there's a lot of information that is carried in the spinal cord, and to link those specific tracks, or they're like wires in a cable, if you will, is still really difficult.
Right. Interesting. So I personally, this is sort of related, sort of unrelated, have a bit of carpal tunnel in my hand. I don't know whether it's related to just overuse in general, mainly on the right hand, and I'm fairly young, but one of the issues though, and I've been sort of reading into it, is that the nerves will regenerate over a period of time, up to a certain point, up to like, I think it's a couple millimeters per month. Is that sort of related all throughout the body, or do you deal with a lot of like hand and joint, and obviously you talked about osteoarthritis? Like, what are some things that people can do related to that? Because I know dexterity, obviously, as you get older, becomes more difficult. What are your thoughts on that?
So that's a good question. In general,
it's actually pretty crappy. It's pretty numb all through here, but yeah.
In general, the peripheral nerves, or the nerves that aren't associated with your brain or spinal cord, they behave differently.
Oh, really?
Than the so that's the peripheral nervous system.
Right.
Peripheral nerves can regenerate. The central nervous system, or the brain and spinal cord.
I should have learned that, I think, in school, right?
Has it? You probably did.
Central nervous system, peripheral nervous system. Okay.
The central nervous system, the covering on those nerves prevents a clean repair.
Okay, so it's that sheath, and so it's just one.
That's
like
right.
you talked about the multiple wires. At that point, you're just dealing with one.
Is a challenge to get together.
Okay, interesting. So I'm sure they can find out a lot more about you if they come out. Where can they, our viewers, where can they find Propel Physiotherapy, find yourself, and tell us, where are you?
We're at Propel Physiotherapy. We're in Etobicoke off the 427 at 1 Eva Road, Suite 107. You can find us at www.propelphysiotherapy.com. We've got news and cool stuff coming up there all the time.
Before you go, I want to thank you again, Kyle.
Thank you.
I was just going to say, is there anything that you wanted to touch on, or that we didn't cover? Or
no, I think that's great. Be safe. Keep your sidewalks clean. And
be nice, clear your ice.
Be nice, clear your ice. Exactly.
There you go. Awesome. Well, there you have it. Kyle, thanks again for joining us. This is the Mobility Shop Live. Again, you can check us out here at the Mobility Shop Live weekdays at noon as well. You can stop by the Mobility Shop. We have 2 locations, one in North York and one in Scarborough, or you can check us out online at themobilityshop.ca. Enjoy the rest of your day. We'll talk to you soon, or see you soon.